So hello guys, welcome back. Today we are going to see retinitis pigmentosa. Okay, so we have divided into definition, pathogenesis, differential diagnosis, systemic association, inheritance, clinical features, types of retinitis pigmentosa and treatment. Okay, first coming with what is definition. Okay, slow degenerative disease of retina, particularly the rods. Okay, retinitis pigmentosa, slow degenerative disease of retina, particularly the rods. Slow degenerative disease of retina, particularly the rods. Okay, inheritance it can be sporadic, autosomal dominant, autosomal recessive and X-linked. Okay, sporadic means 45% it is sporadic, no family history. Autosomal dominance is 25%, that is better prognosis. Autosomal recessive it is 20% associated with systemic syndromes. X-linked recessive 8%, that is the worst prognosis. Okay, X-linked is the worst prognosis. What is the pathogenesis? Retinal pigment epithelium proliferates and migrates into anterior retina. Okay, there is retinal pigment epithelium, above which is a neurosensory layer. Okay, the retinal pigment epithelium proliferates and migrates into anterior retina. Okay, melanin deposits in and around the retinal arterioles, and bone spicules pattern of pigmentation, hyalinization of walls of arteries. Okay, what all is seen? Retinal pigment epithelium proliferates and migrates into anterior retina. Okay, you already know. Here downside will be retinal pigment epithelium, upside will be neurosensory layer. Okay, this one is the neurosensory layer, this is the pigmented. Okay, this will proliferate in the neurosensory layer. Okay, like retinal pigment epithelium will proliferate in the neurosensory layer. Melanin deposits in and around the retinal arterioles, bone spicules pattern of pigmentation, hyalinization of walls of arteries. Okay, symptoms are night blindness, usually begins in second decade of life, and peripheral vision affected first. Okay, peripheral vision affected first. Okay, you can see only centrally. Signs are usually bilateral and symmetrical fundus picture. It is bilateral, both the eyes are affected, and symmetrical fundus picture. Diagnosis based on the triad of, a triad is there of retinitis pigmentosa, that is arterial attenuation, pigmentary bony spicules, waxy pallor of optic disc. Okay, arterial attenuation, pigmentary bony spicules, waxy pallor of optic disc. Okay, field defect, you can see this is a very beautiful diagram. Field effect are pigments are more prominent in mid periphery and around the blood vessels, result in ring like scotoma in a visual field. In advanced case only tubular vision presents. Okay, see, only tubular vision is present. Okay, and ring shaped scotoma is seen. Only central vision is spared, and peripherally you will see ring shaped scotoma. Okay, try to draw this diagram in exam. Next, delayed dark adaptation, ERG, reduced B wave. Okay, and electrooculogram, absence of light rays. Okay, see, let me tell you electroretinogram. Okay, electroretinogram like this and like this, and there will be positive. Okay, this is A, this is B, and this is C. Okay, A wave because of photoreceptor. Okay, this is a negative deflection because of photoreceptor, that is rods and cone. B wave is a positive deflection. Okay, positive deflection because of bipolar cells and ganglion cells. Okay, C wave is a slow positive deflection because it is most commonly seen in dark adaptation. Okay, this is the electroretinogram. Reduced B wave. Okay, size of B wave is reduced in it. Differential diagnosis. Other causes of night blindness are nyctalopia. Nyctalopia means night blindness. Congenital or vitamin A deficiency, extensive chorioretinitis, gyrate atrophy, that is increased ornithine level in the blood, Oguchi's disease, that is yellow metallic sheen on posterior pole, returns to normal after dark adaptation. Disorder mimicking fundus picture of retinitis pigmentosa, that is end stage of phenothiazine toxicity, end stage chloroquine retinopathy, later stage of syphilis, congenital rubella, retinochoroidal atrophy, pigmental paravenous type. Okay, these are disorders making differential diagnosis. Only few you should remember. Types of retinitis pigmentosa, it can be unilateral retinitis pigmentosa or sector retinitis pigmentosa, retinitis punctata albescens, and retinitis pigmentosa sin pigmento, that is no visible pigment deposits. Okay, syndromes associated with retinitis pigmentosa are Lawrence Moon Bardet Biedl syndrome, that is obesity, hypogenitalism, mental retardation, and polydactyly. Okay, so I have seen this one case, that is Bardet Biedl syndrome in a pediatric ward. Okay, once in my hospital. So it was good case. At that time I didn't know much, but now I can read it. Okay, Lawrence Moon Bardet Biedl syndrome. Okay, obesity, hypogenitalism, mental retardation, and polydactyly. Next is Usher syndrome, that is deafness and blindness. Refsum syndrome, increased phentanic acid level, that is ataxia and deafness is seen. Basin Creutzfeldt syndrome, that is beta lipoproteinemia, fat intolerance and diarrhea. Okay. Kearns-Sayre syndrome, ocular myopathy and heart block. Okay. Syndrome associated with retinitis pigmentosa. There are some complex terms. Have a look. Okay, try to remember if possible. Treatment of retinitis pigmentosa: vitamin A oral 15,000 units daily, and vitamin B6 for gyrate atrophy. Okay, restrict milk and leafy vegetables in Refsum disease. Refsum disease is increased phentanic acid level, ataxia and deafness is seen. Okay, milk and leafy vegetables should not be taken. For associated macular edema, grid laser photocoagulation can be done. Okay, low vision aids, that is near vision, hand and stand magnifier, telescopic aid for distant vision, and closed circuit television. Okay, genetic counseling to avoid consanguineous marriage. Okay, avoid consanguineous marriage with retinitis pigmentosa. Next, we will also deal with age-related macular degeneration in this only. Okay, age-generation macular degeneration definition, type, pathogenesis, clinical features and management. Okay, age-related bilaterally non-hereditary degeneration of macula characterized by loss of central vision. Okay, macula, big fundoscopic vision, optic nerve here. Okay, here age-related bilaterally non-hereditary degeneration of macula characterized by loss of central vision. Okay, if macula is gone, central vision is gone. Okay, prevalence most common cases are irreversible visual loss over 50 years of age. Risk greater than 50 years of age: hypermetropia, sunlight, smoking, malnutrition, cardiovascular disease. I will not write this.